one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Okay. Item B, study session.
Mr. Chairman,
Madam Manager.
Mr. Chairman, members of the board, each of you individually have been asking for a study session with updates regarding COVID-19 for a few weeks now at minimal. And so we wanted to put this together. I just want to caveat it with, and I'm sure Jeff and Dr. P and Dr. Williams from Mariposa will reiterate, we've got a lot of information coming at us. It is constantly changing. And that's one of the kind of issues in having a study session like this. But we do want to get all the information out that the board wishes and that will be helpful to our public in moving forward. And so I just wanted to kind of open up with that and thank everybody that's on the phone, and thank you all for allowing us this opportunity to speak about our current COVID-19 situation.
Okay. Is Dr. Pereira on the phone, or Dr. Williams, or Jeff? Who would like to start?
I know I saw Dr. Pereira on the phone. There we go. And there's Dr. Williams. Dr. Williams just took himself off.
Okay, is he unmuted? Hi guys, this is Dr. Williams. Dr. Williams, good afternoon.
I apologize. We're having a slight technical issue with audio. We're going to try to call in.
Oh.
You want to get started, Jeff, or do you guys want to ask?
You want to ask me any questions? I don't know what exactly information we have. Right now we're...
Sure. Jeff, why don't you start with where we are with vaccines?
Okay, right now...
Which is what was promised.
Sure. Our vaccine allocation, our first allocation was supposed to be 1,000 doses. We did receive 100 the first week. Second week we received 500, and we did receive the missing 900 this past, actually yesterday, along with an additional 200. So right now we have received a total of 1,700 doses in the county. We are working on what they call Phase 1A. Mariposa is doing the vaccinations right now. 1A consists of healthcare workers, those frontline workers at the hospital, the medical offices, et cetera. Those that are in assisted living facilities that are highly susceptible as well. So they're in the process of vaccinating all those in 1A that wish to be vaccinated at this time. So that's what phase we're in right now. We are working towards Phase 1B. I believe we should be able to, I believe Mariposa, Dr. P and Dr. Williams can answer this a little better, but I believe we're looking to start 1B by the end of the week.
I believe they're on.
How many assisted living care facilities do we have in Santa Cruz County, and about how many people fall into that category of residents and also people that are attending them?
Hear me?
We're starting to hear you.
Okay, good. This is Dr. Pereira. I'm sorry. We're having technical issues. I think we're good. So I'm going to let Jeff speak, and I'm going to do after Jeff.
Yeah, right now, I believe we have 5 assisted living facilities that we've identified, not including the Bowman Center at with the city. As far as the exact number of staff and residents, it varies each one. They're anywhere from about 10 to about 16. So we're probably looking at close to 100 in those facilities.
And is it their responsibility to contact either the state or the county to let them know that they exist?
Mariposa has reached out to them, and we've reached out to them as well to get them on board. A couple of the facilities did sign up with the federal program, which was with CVS and Walgreens, to be vaccinated through their vaccination clinic, I should say. And it's going to be a mobile clinic going out to the sites.
Right. I can comment on that, Jeff, if it's okay.
Sure.
I'm sorry. I'll answer that question, and I can expand on vaccines as you see fit. I'm here with Dr. Williams. So all the long-term care facilities have been contacted. Those who are ambulatory have been to Mariposa or they've been vaccinated. There are a few that are considered essentially homebound, and we're going to visit all of them on Thursday morning. We'll have a clinical pharmacist and a nurse visit them with the vaccine. We're going to vaccinate them. We typically wait 30 minutes to observe for any immediate reactions, and then we'll go to the next one. So our hope is that all long-term residents of facilities will be vaccinated. We're working with Bowman to do the same. So our hope is to complete that as soon as we can. But certainly Thursday morning, the long-term care facilities will be completed.
That's great news. Thank you very much. And when you finish those long-term care facilities, will that be the final group in the 1A?
Well, 1A is, as Jeff mentioned, 1A has involved the healthcare workers. That's a significant number. First responders, and of course, long-term care facilities, where our hope is to finish the 1A group this week. There are always some who will not be vaccinated for some reason or another, and we'll be open to vaccinate them anytime, but it's our hope to finish those. We're using the initial allocation of the vaccines that Jeff may have mentioned, the initial 100 and the second 500 to complete 1A. The initial estimate was about 9 something, but I don't think it's going to get there because some people don't want the vaccine. So we'll be able to vaccinate as many as we can, and then we'll move to 1B, and Jeff can comment on that. 1B includes persons over 75, public safety officers, teachers, and the food industry. And so we're partnering with the health department to make decisions. We only have 1,000 doses that arrive on Monday, an allocation of 100 followed by the 900 that had not arrived, so it's 1,000. And we'll make some decisions. Our plan is to begin public safety officers this week. Like Jeff mentioned, 1B Friday, and then essentially use them all. And as soon as we get the next supply, we'll make decision who goes next. That's the plan. Jeff, does that sound about right?
Yeah, that's our goal right now, is to start with the public safety officials, whether it's the law enforcement, the rest of the fire department personnel that were not vaccinated in 1A, and then move on. It looks like probably to the next highest priority would be the ones that 75 or older, since they have the highest mortality rate. So we're looking to go to that as, say, 1B A or B, I should say. So we want to try to sub-prioritize within that 1B group. And right now we're looking at the public safety first, and then we're going to go to the 75 and older. Then we'll determine the next phase after we find out how much vaccine we're going to be receiving.
It's my understanding that you need to have 2 doses of this vaccine before you are, and what's the word, protected, immune?
Correct.
What's the correct term?
No, fully immunized would be the right term. So typically, we believe that 1 to 2 weeks after the second injection, you'll be considered fully immunized. That's the hope. There were rumors about Moderna not recommending the second dose to allow more vaccines available or cutting back on the amount, the dose. But today, they released a statement that's not the case. So we're going to do 2 shots, 28 days apart, full dose. So in order to be fully immunized, you need to get 2 doses of the vaccine. And the one we have is Moderna. We may get Pfizer in the future, and we're ready. We have the deep freezer that will accommodate Pfizer, and we're ready anytime.
Right. Dr. Pereira, this is Supervisor Molera. First and foremost, I want to thank you both and your staff for all your hard work during the COVID testing. I know you guys have been working nonstop, and as we transition to the COVID vaccinations, I think our big motivation for this meeting is just to make sure we're all on the same page, communicating, and to do whatever we can to help support you all. And, the way things transpired before, and I'm hoping that transpire this way, is that we'll get a big bunch down the road here soon. I just want to make sure we're all on the same page and continue communications. And we appreciate all that you are doing.
Thank you, Supervisor Molera. We appreciate that very much, and certainly testing. We've done that. It's been obviously a challenge. I think at some point we need to make some decisions about what carries a high yield. And I think our intent is to vaccinate fast, because that's that's our best hope. And certainly, while testing is important, we certainly want to allocate our resources to the vaccination piece so that we can vaccinate very quickly after the vaccine arrives. And so far, we've done that. Our goal is to vaccinate. Use our dosages very quickly. I think I've spoken with some of you one-on-one. This illness is so prevalent nowadays. It's so widespread that my position, and I think the position of many, is that we all should assume we have COVID-19. And we should take the precautions. Certainly, testing is important, particularly those who have symptoms. But I think moving forward, we may back off a little bit on the random testing. Assume that everyone could be carrying COVID-19 in an asymptomatic way. Test those who there may be reason for testing. I think there are reason maybe for certain athletes and things of that nature. Certainly, people with symptoms. But I think vaccination is what's going to drive our effort in the next few weeks. So thank you, Supervisor, for bringing that up.
In the 1B category, once we move, I think a question a lot of people are asking is, one, if once we move past the first responders, firefighters, police, sheriff, and we move into the seniors, how do seniors get notified? How do they sign up to come to the clinic? And then if they're immobile, how do they get immunized?
So, that's going to be a partnership we're going to have to create with a lot of people. Certainly, the Santa Cruz County Health Department will be our partner. Some of the agencies that work with the elderly would be. So we'll have to create some partnerships. So at the moment, for the 1A, all the appointments are being done manually, which is not ideal. There were some technical issues with the online registration system. We are testing that this afternoon, and we hope to try it by tomorrow morning. So moving forward, for the 1B, there will be online registrations, which will make the process and the vaccination more efficient. I'm a little worried that the elderly cannot register online. They don't have the ability to do that. So we're going to have to create partnerships to identify those people who need to be vaccinated. I think Mariposa is ready to do whatever it takes, whether it's vaccination in the clinic and elsewhere. We've spoken about, for example, I can tell you this, talking about certain communities where we need to go there. We're thinking about maybe going to Tubac or Patagonia to do vaccination. So it's going to be work in progress. I think every neighborhood may be slightly different. I do know we're going to need help. I do know that we need to create partnerships to make this work. Some of you have reached out to me volunteering to help, and I'm going to do that at some point. So it's going to be a combination of efforts from online registration, manual, phone calls, and et cetera, particularly for those over 75. I see many in that 1B can register online, so that would be very helpful. So combination of things. I don't know if that answered your question.
Jeff, do you have anything to add?
No, like he was saying, the registration portal is going to be active, and it's going to be set up per event, and that would be like the 1B law enforcement, 1B 75 and older. So it'd be each phase would be able to go into each of those sections and would be able to register for an appointment at those facilities that are vaccinating. So we as soon as we find out, and once we're live, we will be putting that link out on our website to let everybody know, and they can get out there and register.
And if I can, you see Ray in the crowd as well. So Dr. P just talked about potentially going out to the community. We also have plans in place where we can roll out, they're called pods, points of distribution, to different areas of the community once we get enough vaccines. One of the issues we have is that we're not knowing our weekly allocation until Wednesday. So tomorrow, Santa Cruz County should receive our weekly doses that we'll receive on Monday. Now, those have been pretty consistent, other than the 900 that kind of went missing. We did receive the 500 last week and the 200 this week, but we are in the background creating incident action plans that we can put into place once we know that we have enough vaccines that exceed like Mariposa's ability to do there at the clinic.
What are the numbers of vaccines that we need to have to do an incident plan?
Well, if you're looking at all of 1B, what we've calculated out, it's approximately 10,000 people total. Now, is everybody going to get vaccinated? No. But we have to plan for that 10,000 people. So to do a pod, we want to be able to run that pod every day or until we run out of that vaccine allotment. So we would need a few thousand doses to run a good pod and to make sure we are capable of vaccinating enough people.
So to do a drive-up test, a drive-up vaccination?
Looking at some of the situations that's happened with drive-thrus, you really have to have appointment-based vaccinations. Because if you look at some of the incidences that's happened in other states, people waited in line like 9 hours in a drive-through just because it's a first come, first serve. So that's not a good situation. So we still really need to use that portal to have that appointment. Whether we end up doing a drive-through or they come to a facility that they can walk in, get vaccinated, wait, and have enough parking area and stuff like this, that's what we're looking at. So we've got a couple different locations On one of the locations on the east side of the county, we could do either. We could do inside or we could do a drive-through. So we've got those situations available, but it really depends on, again, like our number of vaccines we get and the registration portal.
And do either of you foresee us getting beyond this piecemeal 200, 500 per week so that we could actually do that and make a dent?
I hope so. I've
10,000?
reached out to the state. In fact, I reached out again today, and we filled out a little survey, another survey to give them numbers of what we're looking at 1B, because we need to have a better understanding of what our allotments are going to be. And so is the state. State wants to know a month to 2 months out. They don't want to know week to week as well, because they're getting to they'll get their weekly allotment number on Tuesday afternoon, and then it gets allotted down to the counties, and we know usually Wednesday morning sometime. So we're all looking to the manufacturers and to the federal government to find out what our allocations are going to be farther out so we can plan accordingly on these phases.
And in 30 days or in 25 days, when we've been immunizing these people, is there a plan for the state to double the number of vaccines that we start getting? Because at some point, we've given however many thousands of people their first vaccination, they need to have their second vaccination. Does that mean that all the first vaccinations stop?
Now, according to what our understanding is, the second dose is stockpiled. It's a separate allocation from the first shot. So we would continue getting a first allocation, and we'd also get that second dose for the people that's coming back in for their second dose.
So for a while, we're going to be vaccinating people getting the second dose and people getting the first dose.
Correct.
And then Dr. Pereira, the elderly people that are in this 1B, the 75 and older, what kind of communication do they need to have with their doctors to see if they should or shouldn't be taking this vaccination? Is this something they should be starting to do now by reaching out to their physicians?
So, it's a great question. I think it's always a good idea to reach out to the primary care doctor. I think that's always good. The vaccine is killed. It's a kill vaccine, so we can administer the vaccine to the immunocompromised host. At the moment, we want to give vaccines. The Moderna says the only people who cannot get the vaccine are those who have allergic reactions to the components of the vaccine. But, that's hard to know. The vaccine has never been available before. So even people who have allergies to other medications and foods, et cetera, we're vaccinating. We have EpiPen available. We're doing well with that. At the moment, I cannot think of a reason not to get the vaccine, at least the first shot. I think if there's a serious allergic reaction to the first one, you may not get the second one, but we will not know that until the first one. This vaccine can be given to people who are recipients of organ transplant. We vaccinated a few already. And people who are being heavily immunocompromised, taking long-term steroids, tacrolimus, anti-rejection drugs. So the risk of COVID is higher. The benefit of the vaccine, I should say, I'm so sorry about that. The benefit of the vaccine is great. Certainly the risk of COVID is a lot higher. So I think we certainly promote the vaccine. It's a good idea to contact the doctor. We do have screening questions that we ask as part of the check-in process, just to be aware of certain things. For example, people who have serious allergic reactions to other things, we we monitor them carefully. CDC does have some recommendations about that. For most people, monitoring is 15 minutes. For those who have serious allergic reaction to other things, it's 30 minutes. At Mariposa, for the time being, we decided to do everyone for 30 minutes. And that has gone really well because some of these minor reactions take a little longer. So I know that was a long answer to the question, but certainly it's a good idea, but I think the vaccine is really important.
What other questions have people been asking you? What would you like to tell the members of the public? What are some of your thoughts?
So I have Dr. Williams here with me. I'm going to have him also comment, but a couple of things. And Jeff, you've been involved with this. I think we've been doing this for a while. You know, a few things. Number one is the vaccine is still not available for the general public. I think that's important. It will be, but at the moment, we are concentrated on vaccinating certain groups, and those we know who they are. So that's really important. Eventually, you know, there will be certainly the public safety officers and a few others that Jeff mentioned. That's number one. Number two, it's important to get the second shot to be fully immunized. And that's really important. Number three, the reactions we've seen so far with Moderna and Mariposa have been fairly minor. I know early on there was some fear, understandably so, it's a new vaccine, but I think we've given, I have to look at the exact number. I think as of this morning, certainly we're 350, maybe 400. Not sure. I think the reactions have been relatively minor. And I think number four is that, you know, we working together, we're going to get to everyone that wants the vaccine. I'm very confident working with the health department that Mariposa will partner to vaccinate as many people as we can. Number five, even after vaccination, people still need to wear masks, keep social distancing, and wash hands. This is not the moment to do that. We need to continue doing that. So I think those are the highlights. I'm sure I'm going to ask Dr. Williams' comment. He's been working with me side by side for the last few months, particularly in the COVID vaccine. Doctor, will you have any other thoughts?
Yeah, I do. You know, I'm very acutely aware of the anxiety that people have in the community about getting the vaccine. You know, even here at the clinic, you know, we have a lot of people that are very skeptical, you know, even in my own family. So to address that, you know, we recommend a couple of things. The first step is obviously education. So I've already been to a few produce houses, also did training and education among our staff here. But just want to offer, in general, if you know of any places that would like for me or for one of our staff to come and give education on the vaccine, we are more than happy to do so. All you have to do is either, you know, contact me, email, phone. I'll put my information, my direct cell number in the chat section. You know, Dr. Lunderville had a great idea also about creating a fact sheet, which we actually are creating. And also we really want to kind of strategize other ways. For instance, you know, not everyone reads fact sheets, but they will look at videos. So, you know, when we first started, when COVID first started, we created some educational videos. We could do something very similar that kind of talks about the vaccine, you know, the history of it, you know, how it was made, why it was made so fast, you know, the side effects or lack thereof. And we can start, you know, sharing those throughout our community as well. So it all definitely is a work in progress, but like I said, if anyone wants further education, I'm more than happy to help.
Jeff, do you have any?
I'd just like to reiterate what Dr. P said, and that is that we cannot let our guard down just because we have the vaccine and we're starting that process. You know, people still need to wear their masks. They need to social distance, use hand sanitizer, wash their hands, disinfect the surfaces as much as possible, because that's how we're going to stop spreading it right now until we can get the vaccine out to everyone.
Okay, Dr.
Yeah, that's exactly right. And I just want to go back to the comment I made earlier about testing. You know, we still do testing. We do that. We've done testing at our clinic. We have testing for the schools, both Nogales and Rio Rico. We're doing testing next week with the ASU saliva test. So we do all of that, but I think people feel too confident about the test. And in my view, prevention is more important than testing in many cases. Certainly vaccine falls into that prevention piece. So I think the word should be that prevention is more important than testing. There's a quick question here from Dr. Londerville. Yes, so Moderna vaccine is 18 and over, and Pfizer vaccine is 16 and over. That's correct. Yeah, it's only adults. No, the vaccine is being studied in children, but it's not out yet. So Pfizer 16 and over, Moderna 18 and over.
Supervisor Mueller.
Mr. Chairman, I have a general question. You know, it just worries me that, you know, at 200, they're just really piecemealing us. And at this rate, we're going to be here vaccinating very few people for the next 4 or 5 months if we're going at this rate. Who do we need to contact to get us more vaccines, number one? And I'm pretty sure the other question is for Dr. Pereira. Can we handle more vaccines at this point in time?
I think I'm going to let Jeff answer the first question, and then I can answer the second one.
Yeah, like I said, I've reached out to the state health department and I put in a request. I said the exact same thing. Basically, if we're getting 200 to 500 a week, it's going to take us 6 months to get through 1B. So I said, this can't happen. I need more vaccines. So I actually have a call at 2 o'clock. We're talking about the governor's new executive order that came out last week about the allocation process that the state's going to be doing and the possibility of that they could take allocations away from counties and give it to other counties that are in need. So I may have more information this afternoon after that call. Again, like I said, I'm pushing them to get me numbers of vaccines and get the amount we need. So I'm doing the best I can as far as reaching out to ADHS, but I'm limited to what they can do and what I can get done from them.
You know, so Jeff, you can expand on this. If I recall correctly, the initial allocation for the entire state of Arizona was around 380,000 vaccines.
Correct.
Is that correct?
Yeah, that's correct. Yeah, and then it goes down to counties by population. So, and unfortunately, our population is low, and that's where we were only given 1,000 to start with. And I fought for the 1,000. They were going to even cut it lower than that at first.
Yeah, and so that's not a lot for a state that, you know, for the eligible people, 7-8 million people. So there's not a lot of vaccine around. So I agree. I think we need to advocate for that. In terms of capacity for vaccine administration, I think we will partner with others. We have been handling the vaccination on our own, but we're going to need help. I think our resources, no secret, are stretched to the limit. You know, while we do all of this, we still need to see patients for the regular conditions, hypertension, diabetes, heart disease, etc. Testing remains an active activity as well. I think I'm going to reach out to our educators to talk about testing. But certainly vaccination is going to take a lot of resources to do, and we're going to need help. Already began some conversations with the health department about what we can do to get additional vaccinators to help us out, either through a contracting agency or retired healthcare workers, etc. So I have our CEO involved as well. And as we enter the 1B, certainly that's going to be the case. I think we need help, and we'll get that, but we certainly cannot do it on our own, given the number of vaccines we need to administer.
Right, and that's why we're developing those pods, and with the IAPs, with Ray's help, to be ready to open up those points of distribution that we can help with that vaccinations.
When you say a pod, you're talking about a point of distribution?
Yeah, a pod is called a point of distribution. That's where we will be doing the vaccinations.
Okay. And then, is there some type of a mechanism, Dr. Pereira, that you need? We have other private healthcare providers in Santa Cruz County that have staff. Is there a mechanism that you need for those individuals to be able to join in this frontline fight?
Yes, there are some things we need to do, and mostly about vaccination ownership. You know, when we get the vaccine, Mariposa becomes the owner of that vaccine, and we're responsible for those vaccines. So we need to create mechanisms by which we do some credentialing with those individuals and so on. So that we're working on that as well. There are some, I do know there are some paramedics that can vaccinate. There are some pharmacies that can do the same. So we're working on a mechanism to bring in that help, to help us do that, while at the same time, Mariposa remains responsible for those vaccines. Good question.
Can that be done through the county, and the county is providing you the additional help, that the county is taking that responsibility instead of putting it on you, or the people come to work for the county and they're assigned to you? It's a thought. It's a little bit in the weeds, but there's got to be ways that we can mobilize the other medical
Sure.
community in our.
No, I agree. I mean, I think the intent is good. I think there are some administrative issues we need to overcome. Our CEO is working on that. I think we're going to move on this pretty quickly. I know some of you have come to me, Dr. Lunderville and others, to provide staff and facilities. So we're working on that. We need a lot of vaccinators. I don't know how many we're going to need. At least 10 every time, maybe more, to be able to do hundreds every day to get where we want to be. I mean, the bottom line is that our goal is to vaccinate quickly as soon as we get the allocation. You know, if we use the vaccines that come to us quickly, that would be fantastic. I know that we want more vaccines, but it's the initial goal, it is our initial goal to use what we get. Mm-hmm. And if we do that, that's a plus. I think certainly with the help of Jeff and his staff to advocate for more, that would be fantastic. But at the moment, our initial goal is to use the 1,000 we have, and that's going to be done in the next few days.
Okay. Jennifer?
And I think Supervisor Becker, Supervisor Malera, Supervisor Reese, I mean, I want to assure you all that we are doing everything that we can. I have had discussions with District 35, Tubac Fire, City of Nogales. So all those partnerships are going on behind the scenes and getting things in place legally, getting a term called onboarding so that other people can give shots, and discussing about county owning vaccines. Ray's been working hard again. You see Ray and Frank in the audience. So we are doing all that behind the scenes in hopes that if we get a weekly dose of 2,000 to 3,000, that we're ready to implement those partnerships Our partnership with Mariposa is strong. I think we've proven that throughout the pandemic, and we're extremely grateful for all the work and partnership that they've given us to make this as successful as it has been so far.
Right.
So I just want to reiterate that we are, even myself, are making calls to our partners throughout the county to get things like this in place that you're suggesting.
Right, and we are working with the pharmacies, the national pharmacies, the larger groups are getting onboarded to be able to give the vaccine. So we will be able to allocate directly to them, hopefully in the near future, that they could also participate in the vaccinations. Just to give you an example, when he's talking about manpower, to do just a single pod that we've got, our first one that we've got the IEP going, we're looking probably between 21 to 25 people to run a pod, and we're only using 6 vaccinators at a pod. That's all the other auxiliary staff we're going to need to get them through, to observe them, and so forth. So it's not just 2 or 3 people, it is quite a few people to run a pod. So those are what we're looking at. So if we're going to try to, start up 3 or 4 pods to help Mariposa out, we're looking 75 to 100 people to help us out.
Most people equate the only similar experience they have to getting a vaccination is being vaccinated for the flu. And it's a very simple, for flu, you just show up, yeah, that's me, sign the paperwork, here's my insurance card or whatever. They give you the shot and you're on your merry way. But this is a completely different experience.
Correct, and like Dr. P said, you got to observe them for at least 15 minutes, 15 to 30 minutes after that, so there is no adverse reaction since it is a new vaccine, because we don't want to have somebody leave the facility and all of a sudden have an allergic reaction and have serious issues.
That's a challenge when you do drive-through vaccination. Not impossible. I know Phoenix has done it. But certainly it's a challenge to monitor people in their cars for some of these things. So I'm not saying we will not do it, but it's a challenge because in our rooms, for example, in our conference room, we have a nurse looking at every single individual. And we've had a couple of cases where, there might be a slight, rash or something like that, and they come to us right away. And we address it immediately. So it's so important to do that. And like I said, most reactions are minor, but they're not minor to the patient. They need, they want to see what we think about all of this. So it's really important to monitor actively. Active monitoring. It's not just to sit down and wait. It's someone looking at each individual. Are you feeling okay? You're not feeling okay, etc. So drive-through presents some challenges.
Jennifer, what were some of the other questions that perhaps Manny, Supervisor Reese was bringing up, and Supervisor Malera and I were talking to you about? We've been asking you, we've been peppering you with questions for a few weeks now.
I think one of the things that we've talked about, and Dr. P has hit on testing some, but just maybe since we have the public here listening, our Santa Cruz County site in Rio Rico has extended our testing hours. And so that's another resource. And again, in hopes that Mariposa could focus more on vaccination. So our testing hours are Monday through Friday from 8:30 to 5:30 right now. And so that's another resource and things that you as board members have been asking me individually. Let's see.
Yeah.
I think one of the other issues were some of the changes that the executive order that the governor issued last week, what those changes were. And I don't know that I can speak on those. I haven't been up, Jeff and I haven't updated enough for me to.
Well, actually, there hasn't been a lot of updates in that. We haven't, the health officers haven't met since that executive order came out. Our Thursday call was canceled because of the holidays and stuff. So that's what this afternoon's call should be focused on, and that's what it's supposed to be. So hopefully, again, like I said, I have a little bit more information regarding that executive order this afternoon, and I will update Jennifer as soon as I know.
And then currently right now, how is our testing facility performing? Are we filled, are we sold out, do we have time available?
Up until
we just
extended the hours starting yesterday. We were doing morning for a little while, and then in the afternoon, we have just extended. Yesterday, I think, was pretty full. I think they are trying to fill up every day. You know, people are calling, and we are getting the calls to go get tested. So yeah, we are seeing the volume.
Is there any chance of us staffing up? If Mariposa is talking about using their staff to do mostly the vaccinations, we're going to see people who need testing being pushed to other resources. And ours is about the only free resource in, I don't know if that's a correct statement, the only free resource in Santa Cruz County.
The issue is staffing up. We're pulling some of our case investigators to run these testing right now, so it kind of pulls from their other duties as well. So we are reaching out for more applicants and help with some of this stuff. So as far as the testing or case investigation, so we are trying to ramp that up a little bit as well.
So there's a need for people to help us run that.
If we're going to ramp up even more, staff even more, correct, we would need more staff.
What I would probably do if those appointments like sell out per se, and we want to ramp up, we've got some people that both District 35 and Nogales Unified had loaned us while they've been at a hybrid method or out of school. So probably my first call would be to those two school districts. I know Dr. Lundervild's on the phone, and both school districts have been extremely helpful. Dr. Lundervild we have one of their employees right now. So that would be my first call after we see if these appointments kind of sell out. So we can definitely ramp up if the need is there. So the answer is yes.
You know, yeah, so I appreciate the acknowledgement that I think at some point we need to reroute those resources to vaccination. We still do testing. We do testing at our Nogales site and Mesquite building and the Rio Rico Clinic. Those are usually Monday, Tuesday, Wednesday, Thursday, and Friday, typically 8:15 to about 4. And then Tuesday, 9:15 to 4. We also do testing at our Nogales West. That's a former Correndale Medical Group, which now belongs to Mariposa. So we have those testing sites. That's 3. In addition, we've been going with the assistance of the school districts, we've been doing school testing for athletes at Nogales High School and the Rio Rico High School. And then we have an event, I believe it's the 12th, to do saliva tests for the community, including produce. So we continue to do testing, but like you said, at some point we need to make some decisions about rerouting the resources to really do the right thing, which is vaccination. And maybe we can do more community education about testing, not rely so much on testing routinely, but rather on prevention. And I think Dr. Williams and I are available to do some of that when needed.
Supervisor Valera?
I just would like to see a follow-up study session down the road sooner rather than later. That way we don't lose this communication and continued dialogue. I think it's real critical for us to really make it happen in a good way.
Okay, so
Yeah.
Dr. Pereira, we're trying to be respectful of your time. You said you had an hour. We've got about 11 minutes left.
Yeah. No, I'm happy to answer any questions. I'll reserve the time. I know there's a lot of things to talk about. I want to emphasize what Mr. St. John said earlier. This is rapidly evolving. And sometimes I find myself saying something different every day because of what I learned and how quickly we make changes on testing and workflows and vaccines. So if you hear something from me today that is slightly different tomorrow, please accept my apologies. Is that we make changes very quickly to adjust to the need and to adjust to the incoming information. And
Okay.
so I apologize, but I'll do my best to be as consistent as possible. But I'm happy to answer other questions about not just about the process testing vaccine, but about the illness. So maybe I'll talk a little bit about that just real briefly. COVID vaccine is recommended even for people who have COVID-19. What we do, we wait until they're off isolation and they're feeling well to vaccinate them. The Chief Scientific Officer and Operation Warp does recommend that, and as well as Pfizer and the others, so that's important. Also, no vaccines 14 days prior and 14 days after COVID-19 vaccine. OBs do recommend vaccination in pregnancy and breastfeeding women. The feeling is that the risk of the illness is higher than the vaccine. So those are the most common questions we get here at the clinic. So I just wanted to clarify that. That's what we follow. And, we have a good working relationship with the health department. I call Shelley, Jeff, and Fernando almost every day, I would say. And we talk about cases, so we have a good working relationship. So want to make sure you know that's really key. And I think our relationship is going to evolve in the next few weeks, mostly to reach out to the people over 75. That's going to be key. How do we do that? How do we get in register? And all of that.
That is going to be a challenge, and that's something that we're all going to have to work on. Either encouraging their family members to take care of some of those online registrations, or even if we're going to have to handle it internally with some of our case officers, tracers, have a phone number where people can call in and we can enter the data for them. If it all has to be online, it's a pretty tough thing. Then the hard part is if they want to print out to bring to the testing site, to the vaccination site. There's so many questions, but I really appreciate the effort of Mariposa Community Health Center. I value the partnership that we have with the county and has had for many, many years. It has been beneficial for both of our institutions. And I just thank you for your time and your effort. I know for our health department, they're working around the clock, and I'm sure you're putting in more than your usual 10-hour day to get this done.
Glad to do it. I want to thank all of you for your support, and like I said, our partnership is strong. This is our community. Bottom line, I live here just like all of you, and we have a fundamental desire to change this, and it does take effort, and it's going to take vaccination. You have my reassurance that I'm going to make everything I can to vaccinate as many people as I can to change the curve, essentially. That's our best hope. Whatever we're doing now is not working. We have cases. I know we talk about prevention, but people are not doing it. A lot of social gatherings, spreading of the illness very quickly. So our best hope is vaccination, and that's what we want to put our resources at the moment. Thank you, everyone.
Thanks. And to the people that are listening or are going to read about this, we're talking about prioritizing, police, fire, sheriff, and there's so many people in this 1B category, the 75 and older. The people that are working every day at Safeway, Walmart, Via's, the people that are collecting that are doing the trash collection, the people that are doing, there's so many people that are in this 1B category, the utility line workers, CBP officers, Border Patrol. It's a monster of a category, and we are doing everything we can to try to get enough vaccinations here and to make sure that we're ready so that when we have a large shipment that we can mobilize and get this going. But it's just, everybody has said, it's a very fluid situation. It changes. Please be patient, but just trust that we are working very hard for you. And if you have questions, reach out to us. We are, I answer my phone all the time. Email us, however you think you need to do to so you feel comfortable, so you know that we're working for you, let us know what we can do to help you. Jennifer, do you have anything else you'd like to add? Jeff?
No, all I say is just keep an eye on our website as well. We will update it as soon as we know anything regarding the vaccines and what stage we're moving to. If we go to 1B, what category of 1B is going to be vaccinated next. We will keep it updated as soon as we get notified.
Okay. And those decisions are being made locally? Are they being made by the state? Are they being made by the federal government? Who's choosing?
The order of the 1B, the county health department along with Mariposa are in consultation and looking at the risk factors of each of those categories and categorizing by those risk factors, as well as, public safety. We need to have the public safety. That's got to be a high priority. Then we are looking at the mortality rate of the 75 and older. We are going to take a look at the next groups after that, as far as the teachers, as far as the essential workers, the food workers and stuff like this. And we're going to reach out to each of those entities and probably see what their priority they think. Some of their people may, the office workers may not need to be as far as the warehouse workers or the people that are on the floor at Walmart compared to the people that are in the office or something like that. So that we're working on all those stages right now, and that's within consultation with Mariposa.
Okay. All right, Dr. Pereira, do you have anything else, or Dr. Williams, do you have anything else that you'd like to add in closing?
No, just I put my information in the chat section. Feel free to contact me if you have any questions at all.
Yeah, and no, the only thing I would say is, let us know how we can be of help. It's critical that we work together and that people get a good experience. Our workflow to get the vaccine has worked really well. You should expect to be here about 45 minutes or so, probably no longer than that unless there's an issue. So please let us know if we hear anything or anyone that for some reason not getting the right experience or whatever. Please let us know. We'll reach out to them and make it work. Okay.
Okay. So the phone number for the health department is on our website. Our phone number for to sign up for the free testing at the Rio Rico facility is also on our website. And I don't think we are within a couple minutes of when we need to end this meeting. And I'd like to thank everybody for signing in. I'd also like to thank Dr. Williams and Dr. Pereira for their time. Supervisor Molera, Jennifer, Jeff, Ray, Frank, thanks for coming down. Juan, thanks for keeping our IT running. And everybody, be safe, wear your mask, social distance. With the light is at the end of the tunnel. We can see the light. We just going to take us a while to get there, but be patient. We'll get there. Okay, thank you very much. Have a good afternoon, everybody.
Thank you.
Thank you, everyone. Thank you. Bye-bye.
And so item C, we are adjourned.